Yeah, the UVEA-IXA study was a study which was based on a retrospective chart review, and this the study has been conducted in several European countries, and it included, I think, 309 patients. Patients had at least one prior therapy, so a window of prior therapy was 1 to 3 prior lines of therapy. The median age of the patient was 68. ECOG status was 0 to 2. And interestingly, there was a relatively high proportion of patients with high-risk cytogenetics, but namely 30% as compared to 70% of patients with standard risk cytogenetics. Why is it? When patients relapse, they tend to have to develop high-risk cytogenetic features. So at the beginning, the incidence of high-risk cytogenetic features is about 20%, but after several relapses, it goes up. And in this study, in the entire patient population, the incidence of high-risk features was 30%. And the time from diagnosis to start of ixazomib, Revlimid, dexamethasone was 33 months. So patients were started on IXA-RD, and this went very well because the overall response rate was 67% in the patient population, and the PFS duration was 15.6 months with this oral, easy to administer treatment regimen. When you look at patients who had only one prior line of therapy, then the PFS goes up to 19.6 months. Now you ask the most important question, what was the overall survival? It was 35.5 months in all patients taken together. Now, if the treatment well tolerated, I think we can clearly say that the treatment is very well tolerated. There are few grade 3 and 4 adverse events. There may be diarrhea, but mostly grade 1 and 2. There were only 2% grade 3. There may be thrombocytopenia, 5% grade 3. Some people develop neuropathy, but only very few, 6%, and almost no PMP with grade 3 and higher. Rash, vomiting, very rare. So actually, the treatment is well tolerated. There may be some gastrointestinal irritations. I mentioned already diarrhea, which is seen in a few patients. Infections are relatively rare, so it is one of the beauties of this regimen, apart from being completely oral, is that it's very well tolerated and you can do it at home, and you can limit the visits, hospital visits to once every month. And so that is something which is very well accepted from our patients. And as mentioned, the response rate was quite significant. I mentioned it was 67%. It is slightly lower in patients who have been exposed to 3 prior lines of therapy, and the same is true for patients who had, for PFS, the best PFS was seen in patients with only 1 prior line of therapy, and then there is a slightly shorter PFS in those with 2 and those with 3 prior lines of therapy. Taken together, the feedback from patients was excellent, from those who benefited in terms of response, long progression-free survival, and overall survival. But of course, not everybody responded, but 2/3 of the patient benefited significantly from this type of therapy. So it's very well established now and recommended to patients who want to be treated with an oral regimen.